Welcome, everyone. We're doing a deep dive today into, well, something that really touches all of us, healthcare and the economy and that connection between them. You sent over some really fascinating sources, including one from the Journal of the American College of Cardiology. So our mission really is to unpack these insights, give you a shortcut to understanding these critical economic forces shaping global health. Maybe we should start with just the sheer size of it all. The healthcare footprint. I mean, did you know in the U.S., healthcare is nearly 1/4 of government spending? One
Mhm.
quarter. And it employs, what, 11% of the entire American workforce?
It's just immense, yeah. There was a 2020 Brookings report that put it plainly. Basically, a well-functioning healthcare sector is therefore a prerequisite for a well-functioning economy. Simple as that.
And that's not just a U.S. thing, right?
No, absolutely not. The economic impacts are global. We really saw this with the COVID-19 pandemic, didn't we? It just underscored how interconnected everything is. Strained resources everywhere, supplies, equipment, staff.
Right. And, what we've really seen lately is how inflation just makes all these pressures even worse. Speaking of inflation, that, steady rise in prices that eats away at your buying power.
Hmm.
One of your sources actually quotes Ronald Reagan. He said, "Inflation is as violent as a mugger, as frightening as an armed robber, and as deadly as a hitman." Pretty strong words.
They are strong words, and it reflects the reality that inflation hit, a 30-year high recently? And healthcare, well, it's kind of uniquely vulnerable when dealing with it.
How so?
Well, unlike some big companies, with huge pricing power or really low labor costs, healthcare is mostly stuck. It either has to absorb costs or try desperately to control them because you've got these big labor challenges and pricing that's set externally, often annually.
Okay. So it can't just pass on the costs easily.
Exactly. It's a very tight squeeze.
So given these vulnerabilities to things like inflation, how do we actually find solutions? And this is where one of the concepts you flagged comes in Mohammed El-Arian's idea of game theory.
Yes, game theory. It's fascinating here because it gives us a powerful way to look at this. It pushes us beyond thinking about, say, just one hospital or one insurer solving things alone. It shows how everyone's choices, hospitals, insurers, governments, practices, they're all linked. Their strategies depend on each other.
Okay.
So there's this piece in modern healthcare that describes the game. It talks about the elements, who the players are, the value each brings, the rules, the tactics, the scope. But here's the really crucial insight. Players can both play the game and change the game at the same time by strategically changing the elements.
Change the game while playing it.
Precisely. As El-Arian put it, the idea is if you can adjust internally, you adjust together. It's about coordinated strategic shifts.
That sounds potentially really powerful. So what kinds of strategies or moves, I guess, do the sources suggest we look at within this game?
Well, they highlight several key areas. One big one is investment in clinician well-being and mental health. This is about supporting our healthcare providers, encouraging them to stay in their jobs, frankly.
Makes sense. Burnout is a huge issue.
Absolutely. And the source mentions the Dr. Lorna Breen Act as a great example of people coming together on this. It links directly to the quintuple aim: improving patient experience, population health, provider well-being, lowering costs, and advancing health equity. All five.
Okay, so supporting the current workforce is step one. What about making the system itself work better?
Right. Another critical move is implementing value-based care models and really leveraging digital transformation. Think about COVID again. It really pushed models like remote patient monitoring, right?
Yeah, telehealth exploded.
Exactly. And those models often have lower overhead compared to the rising costs of in-person care. So it's a strategic shift towards, efficiency and hopefully better outcomes too.
And thinking longer term, we need people coming into the field too.
Definitely. The sources really stress fostering the next generation of clinicians and starting early, like middle school, high school, getting kids interested in science and medicine. Plus, specific programs to help underrepresented groups get into fields like cardiology, for instance, Blacks, Hispanic Latinx communities.
Okay, so we've got supporting current staff, improving the care models, building the future pipeline. What about the big picture, the rules of the game?
That's the final piece. Advancing health policy solutions. This needs collaboration, nationally and globally, working together on big issues like surprise medical bills, patient access, cutting down on administrative hassle. The pandemic, for all its horrors, did show that we can be so much stronger together when there's a shared goal, a shared vision.
It really feels like everything is connected here. The economy, big global events like the pandemic, geopolitical shifts. You mentioned Russia's invasion of Ukraine impacting commodity prices.
Indeed. And the healthcare sector inevitably feels those impacts. It's unavoidable. So the sources are basically saying there's really no time like the present to start thinking in terms of this game theory, to use it in how we define problems and look for solutions. You know that old saying, a stitch in time saves nine? Well, maybe here it's a stitch in time saves lives and keeps the whole system viable, equitable, and, well, healthy.
So thinking about all this, especially that idea from game theory that players can change the game by changing the elements, what really stands out to you, our listener? Which part of this whole healthcare economy challenge do you think could most benefit from this kind of collaborative, game-changing approach? And maybe even think about what element could you potentially influence or change, even in a small way, something to mull over.